Artificial Intelligence Doctor. User question. What are the optimal glycemic targets for elderly patients with diabetes, considering the balance between preventing complications and minimizing the risk of hypoglycemia and other adverse effects? Gemini Advanced Answer. You're asking about a great and very important topic. Managing diabetes in elderly patients requires careful consideration of the benefits of tight glycemic control versus the increased risks of hypoglycemia and other adverse effects that come with age and potential comorbidities. Here's a breakdown of the current thinking on optimal glycemic targets for elderly patients with diabetes. General principles. Individualization. The most crucial principle is to individualize glycemic targets based on the patient's overall health status, life expectancy, presence of other medical conditions, risk of hypoglycemia, and personal preferences. There's no one-size-fits-all approach. Prioritizing safety. In older adults, preventing hypoglycemia is often prioritized over achieving very tight glycemic control, as hypoglycemia can have more severe consequences in this population: falls, fractures, cognitive impairment, cardiovascular events. Simplifying regimens. Complex medication regimens can be difficult for elderly patients to manage and may increase the risk of errors. Simplifying treatment plans is often preferred. Assessing cognitive function. Cognitive impairment can significantly impact a patient's ability to manage their diabetes effectively. Regular cognitive assessments are important. Regular monitoring, frequent blood glucose monitoring, and regular checkups are essential to assess the effectiveness of the treatment plan and make adjustments as needed. Specific glycemic target recommendations. The optimal glycemic targets for elderly individuals vary based on their functional status, cognitive capacity, and comorbidities. Below are some helpful recommendations for different categories of patients. 1. Healthy, few coexisting chronic illnesses, intact cognitive and functional status. HbA1c, 7.0 to 7.5%, 53 to 58 mol/mol. Fasting or preprandial glucose, 80 to 130 mg/dl, 4.4 to 7.2 millimoles per liter. Bedtime glucose, 80 to 180 mg/dl, 4.4 to 10.0 millimoles per liter. Rationale. These patients may still benefit from relatively tight glycemic control to prevent long-term complications, as they are likely to have a longer life expectancy. 2. Complex/intermediate, multiple coexisting chronic illnesses or 2+ impairments in activities of daily living, ADL, or mild to moderate cognitive impairment. HbA1c, 7.5 to 8.0%, 58 to 64 mol/mol. Fasting or preprandial glucose, 90 to 150 mg/dl, 5.0 to 8.3 millimoles per liter. Bedtime glucose, 100 to 180 mg/dl, 5.6 to 10.0 millimoles per liter. Rationale. A slightly higher HbA1c target is generally acceptable in this group to reduce the risk of hypoglycemia, especially if they have functional or cognitive impairments. 3. Very complex/poor health, end-stage chronic illnesses or moderate to severe cognitive impairment or 2+ ADL dependencies. HbA1c, 8.0 to 8.5%, 64 to 69 mol/mol. Fasting or preprandial glucose, 100 to 180 mg/dl, 5.6 to 10.0 millimoles per liter. Bedtime glucose, 110 to 200 mg/dl, 6.1 to 11.1 millimoles per liter. Rationale. In patients with limited life expectancy or significant cognitive impairment, the focus shifts to symptom control and avoiding hypoglycemia. Stringent glycemic control is often not beneficial and may be harmful. 4. End of life. HbA1c, not appropriate, as measurement is generally not helpful at this stage. Glucose targets. Avoid symptomatic hyperglycemia and hypoglycemia. Rationale. The primary goals are to maintain comfort and quality of life. Strict glucose control is unnecessary and should be avoided. Important considerations. Hypoglycemia risk. Certain diabetes medications, such as insulin and sulfonylureas, carry a higher risk of hypoglycemia. Careful selection and dosing of these medications are critical. Comorbidities. Conditions like heart disease, kidney disease, and liver disease can influence glycemic targets and medication choices. Patient preferences. The patient's values and preferences should always be taken into account when setting glycemic goals. Disclaimer. It is important to note that these are general guidelines, and the specific targets should be determined in consultation with a healthcare professional who can assess the individual patient's needs and circumstances. Please do not make any changes to treatment without consulting a doctor.